Good morning and welcome. Thank you for joining our community conversation on Central Health's fiscal year 2022 budget. This community conversation will take place in Spanish at 1 o'clock this afternoon. Esta plática comunitaria se llevará a cabo a la 1 de la tarde el día de hoy. My name is Ivan Davila and I'm the Director of Communications and Community Engagement at Central Health. With us today, we have Mike Giesling. He is the Central Health President and CEO. We also have Lisa Owens. She is the Deputy Chief Financial Officer. And we have Ted Burton, Vice President of Communications, and our wonderful production staff helping us behind the scenes. Thanks everyone for being here. Before we get started, we'd like to go over some virtual house rules. We recognize the collective trauma endured by communities who have repeatedly been impacted by health inequities. We recognize that this trauma can be manifested in the expressions of a wide array of emotions. Through our community engagement programs, we hold space for this wide array of emotions. And having said that, we are committed to creating an atmosphere of mutually respectful and beneficial dialogue. We ask our public meeting attendees to join us in this commitment. To maintain a cohesive, productive working environment, we commit to staying aligned with our mission, offering alternative solutions when addressing a problem or issue, showing respect to each other, promoting productive discourse during our meetings. When the discourse has become disrespectful and unproductive, the moderators commit to intervening to preserve a constructive, productive environment for all participants. If a question comes up during our presentation, please drop it in the Facebook comments and we'll address it during the Q&A portion of the meeting. If we don't get to your question, we will have our experts address them and send to all of those participants who RSVP'd in a follow-up email and answer them in the comments section of the Facebook Live. Thanks again, everyone, for joining. Today, next slide, please. Today, we'll share with you, one, how Central Health is empowering communities with care, two, our community engagement efforts for fiscal year 2022, for the fiscal year 2022 budget, and of course, the fiscal year 2022 budget. At this time, I'll hand it over to Mr. Mike Giesling, who will kick us off. Thank you, Mike.
Yes, thank you, Ivan. And thank you for joining us on Facebook Live, and not only for this meeting, but also for our prior conversations that we've had and surveys too, whether that's an online or a telephone survey. So your input and participation in this process is essential to how we move forward. We can advance to the next slide, please. I'd like to talk about empowering communities with care. And this is a theme that's going to, you'll see that guides and shapes and forms of this conversation that we're fortunate to have with you all here today. But exactly what does that mean? And I'll answer that by saying, let's talk about the how. To empower communities with care and so that people can live the healthiest life possible, we have to know and serve communities at the margins. And that's what we do here at Central Health. And so in addition to investing in primary and specialty care and dental care, and we have additional areas where we want to make additional investments above and beyond what we're doing. And those are in areas such as specialty care access. I'm reading there from the bottom of the slide, if you're able to see it. Healthcare for the homeless, behavioral health, substance use disorder, clinical and patient education, and transitions of care. Next slide, please. And if you've joined us in prior budget years, community conversations, you know that for the next few years, we are driven by 3 strategic objectives that are set by our board of managers, which is the ultimate governing authority for Central Health. And that's 1, to develop and execute healthcare delivery based on people in place. 2, objective number 2, kind of moving clockwise there across the slide, implement patient-focused and coordinated healthcare system. And then 3, a sustainable healthcare financial model for healthcare delivery. So I'll talk a little bit about each one of these because it forms the basis of our budget that we present to the board and to the public and to the Travis County Commissioners Court. And again, these are based on objectives and strategic priorities established by our board of managers. So objective number 1, develop and execute healthcare delivery based on people in place. As you can see, we're going to continue with our work on the Eastern Travis County site expansions. Last year when we talked, we had some land purchased. we were about to purchase some land. This year we have site development documents filed with the county and hopefully in the city, and to get approval so that we can begin actually moving dirt, hopefully by the fall of this year. We also have active and open procurements for a general contractor for both Hornsby Bend and Del Valley. And then we hope to have the land transaction for Colony Park completed early part of next month, in September. And this, again, these are carry forward from prior fiscal years, but it is our, not only at the management level, but the board level, and working with community groups to push the Hornsby Bend and Del Valley projects to the point we've started construction. And that is absolutely a top priority for us. And then, of course, completing the land transaction with Colony Park. Second objective, again, moving across from left to right, implement patient-focused and coordinated healthcare system. The first item there, systems-based planning and health equity. You'll see phases 3 and 4. This is work that we've already begun, but we're going to continue that throughout this coming fiscal year. And to sum it up, it's about looking at the healthcare system through an equity lens. What is it that we need to do to alleviate a health disparity, whether that's looked at by race and ethnicity or gender identity, but focusing on what those equity gaps are, and then working to invest to long-term, mid-term, and short-term to do away with those gaps, to make the right investments to be able to build out a strong system of care that brings about health equity. Now, more immediately, if you kind of go down the right there, systems-based planning and health equity, immediate service delivery focus areas, as I mentioned before, and you'll hear more about it in this budget presentation. In addition to what we're doing this fiscal year, we have additional services and funding planned for this coming fiscal year for specialty care access, healthcare for those experiencing homelessness, behavioral health, substance use disorder, clinic and patient education, and transitions of care. And again, you'll hear more about that in the presentation, about what those levels of new and additional funding will be. Third, moving back across to the left side of the page, sustainable financial model for healthcare delivery. Again, the Brackenridge campus and the consolidation of administrative offices. These are much longer term projects for us, but one, the Brackenridge campus is about generating additional revenue for our mission. Again, this is a long-term development. The administrative consolidation is about saving on lease costs that ultimately generates additional funds for healthcare in the long term. But that brings us back full circle to objective 1, which is our top priority, the Hornsby Bend and Del Valley and Colony Park Health and Wellness Centers. Next slide, please. And this will be my last slide before I hand it off. If I were to try to sum this up, and you think about, what's the big message in this slide? There's a lot of words here and lines, but it's this, is that, we want to be a great organization. We're a great organization now. We want to continue to up our game. And if you think about our culture, what does that mean? Well, you want to have a culture that is inclusive and looks at issues both internally and externally through an equity lens. We want to have a strong compliance and operational underpinnings so that, we've got the technology and the facilities and the HR processes in place and the compliance and the procedures in place to function well as an organization. And of course, we want to have a sound budget and fiscal programs, which is one of the reasons why you see the Government Finance Officers Association award that we've earned 2 years in a row now. We'll continue to strive to earn because that says a lot about our budgeting and our fiscal processes, but also our transparency in terms of having these conversations and making information available for people to see and understand how it is that we invest dollars to improving healthcare. So as a healthcare district, we're growing. The county continues to grow. Unfortunately, there are families that will continue to, the number of families and persons experiencing poverty across all of Travis County, but especially in the Eastern Crescent, will continue to grow. And so we need to grow and be strong as well so that we can be good public servants. And so I think as our operating environment becomes more complex, we want to focus on, just as you see at the top of the slide there, organizational excellence. And that's both in what we do, but also our culture is what we are, what we live to be every day. So we want to make time and resources available to be just such an organization as we serve those at the margins and that have been subject to health disparities and discriminations, and undoing those in their lifetime. So with that, I will turn it over. Thank you.
Thank you, Mike. And so now we're going to go over some of the communications, community engagement, and outreach activities that have taken place over the course of the last couple of months to ensure that we involve the community in our budget development process. If we go to the next slide, please. These are some of the community engagement activities that we have employed to involve the community in our budget development process. As you can see on the screen, we've had community conversations. We had 2 community conversations back in June. It was June 17th, just like pretty much like what we're doing today and this afternoon. One at 11:30 in English and one at 1 o'clock in Spanish. Again, these took place via Facebook Live. And as of July 30th, the English community conversation had 461 views, and the Spanish community conversation had 111 views. And of course, we're having this community conversation right now, and another one in Spanish. The one that took place in June was when we talked about the proposed strategic priorities that we were going to be proposed to our board, and then also to the community. And then we also went out to the community and did presentations of these strategic priorities to some neighborhood groups. And there is a long list of neighborhood groups that we've been engaging with, and all of this can be found in the preliminary engagement report that you can find, and you can see the URL at the bottom of the screen, participate.centralhealth.net/2022 budget. You'll be able to find a video of the community conversation that took place in June, as well as the preliminary report for community engagement. We also conducted telephone interviews. We care a lot about our MAP members and what they have to say. And so we highly value their input. And so to consistently engage with them, we consistently engage with them by employing feedback gathering tactics that meet them where they are. In this COVID time, we have been conducting telephone interviews. So our own outreach and engagement staff picked up their phones and actually held conducted interviews with some of our MAP members, and they were highly valuable. And then we also conducted an online survey. Again, this was all via our online platform that anyone can access via the URL at the bottom of the screen, participate.centralhealth.net/2022 budget. And this was all of this took place in both Spanish and English. Next slide, please. Some of the communications and outreach tactics that we employed to drive traffic to our engagement programs and activities were the ones that you see on the screen. So we employ a newsletter, and also we sent email invitations to about 6,000 contacts that we have in our email list. And we've also been sending weekly emails, excuse me, to our list of more than 600 contacts that are highly engaged individuals, asking them to participate in our budget development process by providing their feedback. Of course, we also use social media, where we also share information via social media, and our outreach team shares information to around 122 Facebook groups that represent some of the community groups that we engage with within our priority zip codes. We also employed a paid digital social media campaign, targeting, and this was also bilingual, and this was targeting people, again, living within our priority zip codes. And as I mentioned earlier, we did direct outreach to our MAP members via phone calls. Next screen, please. So again, I won't go into much detail on the findings of the survey. But as I mentioned, the preliminary report with the analysis, a very detailed analysis of the survey findings can be found via the URL at the bottom of the screen. And but for now, I'll just say that 205 people participated in this survey, 60% of which were community members, that is non-MAP basic members, and 40% of which were MAP and MAP basic members. And you can see the race and ethnic breakdown on the right-hand side of the screen. And Next screen, please. So this, while this is only a high-level overview of our survey results, again, you can find a much more detailed version of this if you follow the URL at the bottom of the screen. The preliminary engagement report also has a detailed analysis for each of these strategies. These are some of the strategies that Mr. Gieslin also talked about at the beginning of this presentation, and you can see the agreement and the support across all of the strategies. During the surveys, the information about our proposed plans was provided, usually followed by personal experience questions, and each section then asked respondents to indicate how much they agreed or didn't with the proposed strategy. If the participants strongly or somewhat disagreed, they were given an additional opportunity to tell us why, and we have all of that in our report. The strategies with the strongest support, as you can see on the screen, were healthcare for the homeless and substance use disorder treatment. And a trend that we saw was that our MAP and MAP Basic members were even more strongly in support of these strategies. That is, they chose strongly agree more often. For example, the facility expansion strategy showed that 54% of non-members strongly agreed, whereas 71.3% of members strongly agreed. And this was common all throughout. Next, I'm going to turn it over to Ms. Lisa Owens to go over the fiscal year 2022 budget.
Thank you, Yvonne. Good morning, Lisa Owens, Deputy Chief Financial Officer. So if we can go to the next slide, I would like to start with talking about our proposed tax rate. I see we already have a question about the tax rate, so hopefully I can address that in this overview. As a taxing entity in Travis County, we do strive to establish a tax rate that supports the healthcare programs and the expansions while limiting the impact to the taxpayers of Travis County. So we use a very long-term planning strategy. It starts in April, and we look out 5 to 7 years at our budget and proposed tax rate to try to manage the many knowns, planned expansions, as well as many unknowns in the healthcare industry. So for the upcoming year, we are proposing to increase our tax rate 6% over the no new revenue rate. That proposed rate is 11.1814 cents per $100 of property valuation. So for the average taxpayer, this will increase their tax bill approximately $40 or $3.50 a month. And also for the upcoming year, we increased our homestead exemption for over 65 and disabled, and that went from $85,500 to $100,000. We already maintain the highest 20% homestead exemption for non-disabled and under 65. But for those taxpayers that are over 65 and disabled, we estimate that will provide them an extra $17 of relief in their annual taxes. On the next slide, if we can look at our sources and uses. So we do prepare a structurally balanced budget. Our primary source of revenue is property tax. And at the proposed tax rate of 11.814 cents of $100 evaluation, that is approximately $260.9 million in property tax revenue. As we mentioned, we do have our downtown campus, and we generate lease revenue from that parcel of about $13.5 million for a total budgeted revenue of $280 million for next year. We estimate our contingency reserves that will be carried forward for healthcare services, and our current fiscal year, we anticipate having approximately $226 million. So our total sources of funds will be about $506 million. We do have two programs, healthcare delivery and administration, and we'll go into a little more detail in our upcoming slides about the uses of funds. But again, we do prepare that structurally balanced budget, so our budgeted uses of funds is also $506 million. If we can go to the next slide. We do look at other hospital districts and establishing our tax rate as well, and we're happy that traditionally and continuing into this year, we do maintain the lowest tax rate of all the other major hospital districts in Texas. Next slide. And we also like to look at the average taxpayer who may live in Travis County, who may be an AISD. This is just one example, and try to see where our percentage of tax falls under that total tax bill. And it is about 4.5% of the total tax bill for someone who lives in these proposed jurisdictions, as an example. So going to the next slide, I'm going to start talking more about what we intend to use these tax dollars for. So we talked a lot about the strategic priorities, and I would encourage you to please check out our website and the great community engagement that Yvonne and his team did. Those reports are out there. They talk a lot more detail about the healthcare services that we provide, but we're very excited that this year we're expanding services in some key areas in healthcare delivery. Healthcare delivery is about 97% of our budget. Some new investments in services for FY22 are in specialty care. We're continuing to expand in very specific areas and growing needs for cardiology, nephrology, podiatry, outpatient dialysis, and other specialty cares. Also, healthcare for the homeless. We anticipate we have approximately $1.7 million in new spending, in addition to the services that we already offer in medical respite, street medicine, and additional funding for access for persons experiencing homelessness. We are also adding about $1 million to transitions of care and clinical patient education. Those areas will really increase getting people into the right level of care in outpatient settings or outside the hospital, or remote home monitoring areas so that people can stay in their home and be monitored. And then finally, behavioral health and substance use therapy expansion. That's just under 1 million. That is additional services in our primary care settings, transitions, and peer supports counseling for substance use disorder. So now I will just hit some highlights on the numbers. This section, this is our uses in the healthcare delivery program. $101 million in healthcare services. This is continued support and those increases I just spoke of in supporting our primary and specialty care through contracted providers that provide services to MAP and MAP basic patients. Next slide. Our healthcare operations and support includes our premium assistance program. This has been an opportunity for us to take high-risk patients and give them access to Sendero Health Plans coverage. We've seen great success in this area, and we are increasing funds there so that we can enroll more members that are high risk into Sendero Health Plans. In addition, this section of our budget also includes internal departments that support our programs, such as medical management, eligibility and enrollment, and analytics and reporting. We undertake a very robust business case process. So all of our departments who are planning new initiatives or adding staff went through that business case process this year. And in 2022, Central Health will also begin the practice of medicine. So we will see some growth in our clinical operations to provide direct services to support some of those new specialty care services that we talked about. Next slide. We maintain several reserves for long-term projects such as capital. I know we spoke a little bit about the Eastern Travis County projects. Some of that is financed through our capital reserves. So you'll see capital reserves here. And then, as I mentioned earlier, we do maintain a structurally balanced budget. So we appropriate to our healthcare delivery program the contingency reserve, and that supports our one-time or known future needs for reserves so that funds are available when needed. Central Health also has recently issued additional certificates of obligation to support the 2 Eastern Travis County clinics in Bell Valley and Hornsby Bend, as well as the development of clinical services and a consolidated headquarters space at the Hancock Center. And that has caused an increase in our debt service there for a total of just over $6 million. Next slide. Last is our administration program. We do maintain a very low percentage of our program in administration. I think it's just over 3%. But we continue to expand to meet the needs of the growing healthcare services. So we do see a little bit of an increase in administration, but overall, this is a smaller part of our budget. And again, Mike spoke about the operational excellence that we maintain as stewards of the tax dollars. And a lot of that work is done through the departments that fall into our administration departments. So again, our total budgeted uses of funds is $506 million. And lastly, on the next couple slides, we started this way before April, but we started our public presentation of the board in April. But in the spring, we had our first presentation to the board, and we're excited on the next slide that we're moving into the final stages of the budget with this community conversation as well as public hearing. so that we can establish the tax rate and the budget before the end of the year. We do have our public hearing scheduled for September 2nd and a Board of Managers meeting on the 9th to propose the vote on the tax rate and the budget before going to the Commissioner's Court. So I appreciate participation, but I also encourage you to please check out the resources on our website. Our budget booklet and the community engagement report provide a lot more information. And we really hope to also encourage continued participation through that participation portal that we had earlier, participate at centralhealth.net, and through our public hearing. And with that, I'm going to turn it over, I think, to Ted Burton, who's going to open it up for questions, I think.
Thank you, Lisa. Thank you, everybody who is watching us and participating via Facebook Live. We do have several questions that have come in, and we will try to answer those to the best of our ability here live. We also will capture these questions and answer them and post them after this meeting. As soon as we can get them answered, we'll put them in writing and post them on our Facebook page as well. So I'm going to just go back to one of the questions that was asked a little while ago, 15 minutes ago. The question, first part of the question is, why are we raising taxes? Appraisal values are up over 10%. Isn't a 10% increase in valuations enough? So I'll pause there. And Lisa, you may, or Mike may want to take the first piece of that.
Yeah, I'll start out, and then Lisa, please chime in. But first of all, thank you for the question. And this is something that the Board of Managers, when we first started our budget process and started doing financial forecasts and projections, had a lot of questions on, as did we. And I think the original proposal was actually up a little bit higher in terms of the tax rate. We settled on something lower because we started crunching numbers and refining projections and realized, we can come in lower. The other thing that I'll point out is a couple more things. Is we are spending down reserves over the next several years. And the reason, well, why do you have reserves? Well, there's a lot that changes in healthcare, and it doesn't always change on, with a whole lot of notice. You don't have a matter of years to adjust to things always. You might have a year, maybe less than that, depending on what's going on. And so having those reserves allows us to respond to changes in federal funding, respond to changes in patient shifts and demographics and changes in disease burdens and trends and so forth. And so it's making sure that we've got that flexibility to be what we need to be. But nonetheless, we came in as conservatively as we could on our tax no new revenue rate, or formerly known as the effective rate, for that very reason, and also because the property appraisal is coming up. I think in future years, as we continue to refine our projections, I can't speak for future boards, but I would say that I would be shocked if this, trying to come in as conservatively as we could on our tax rate is going to continue to be something that we do, for not only for this year, but for the foreseeable future as well. Lisa.
Sure, I would just echo, and I'm sorry we don't have a slide on this, but it's certainly on our website, and we could follow up after. But we do look at different models of long-term projections, and what Mike referred to is very early in the year, we looked at different scenarios to see the long-term impact of that. And so I just kind of going back to the beginning, we do realize that assessed values are increasing, and try to balance that increase in the tax rate with the tax burden, but also it's a very long-term, a 5 to 8 year outlook.
Yeah.
Thank you.
The other thing that, Ted, if I may just real quick, that I'll add is you'll also, and I'll do the quick math real quick for you, but if you look at our revenues that we're privileged to be able to collect and invest in healthcare, that's 97% of our sources of dollars are going towards healthcare delivery. 3% go to administration. This current fiscal year that we're in, and in prior fiscal years, it was 96% and 4%. And so again, we're maintaining, our really trying to be as prudent as we can on our administrative costs so that we can continue to invest well upwards of 97% in healthcare delivery. And that comes back as a community benefit and the value for those we serve in terms of better health and better life.
Thanks, Mike. And I was just going to add, there was a slide earlier, first of all, that the Central Health Board of Managers takes any tax increase very seriously and does a lot of probing with our finance team on how those dollars will be spent. But Lisa mentioned earlier that the tax burden for Travis County for Central Health is 4.5%, the lowest. And we also have the lowest tax rate of any healthcare district in Texas. So those, I think, are two important notes to mention. And healthcare delivery expenditures are increasing. So spending more money on healthcare delivery, as Mike, as you touched on. The second part of this question is, what do the other 88% of Travis County residents with insurance get from Central Health? And can we help reduce the actual cost of healthcare for the rest of us? I can start, and I think everybody could share on this particular question, but I think even if you aren't being served by Central Health, you benefit. If our community is healthier, if individuals are healthier, the entire community is healthier. An example is if people have access to primary care and specialty care, and they can get the healthcare they need inside and outside the clinic, there's less likely to end up in an emergency department, which is the most expensive type of care. And that means if somebody with or without insurance needs emergency care, they can access that care hopefully more easily. There's not somebody in the waiting room who is there for a cold or the flu or something that's non-urgent, non-life-threatening. So that's just one example, I think, of how residents without insurance can benefit. And Mike or others might want to weigh in on that.
Yeah, I think that's a great lead off, Ted, and thank you. And this question comes up in these community conversations. You know, if I have health insurance, so really, how does all this that Central Health is doing benefit me or those of us with health insurance? And it's exactly that. Imagine Travis County, and first of all counties in Texas provide for, and these are the words from the statute, provide care for the indigent. And some counties do that directly. Some counties do that through a hospital or healthcare district, such as Central Health. And Lisa showed a slide earlier, the other urban areas that have hospital districts or healthcare districts and what their tax rates were. And so, you know, that goes back a long way in Texas history in terms of that requirement. But fast forward back to today, if we were not providing care for people, specialty care, primary care, transitions of care when they get discharged from the hospital, care management for those with chronic diseases and comorbidities, it would set up a situation where, as Ted mentioned, you would have more and more people coming into the emergency rooms. Right now, we're in a period where emergency room space is almost non-existent. And I say that, you know, carefully, but it's because of the pandemic that, I should say, additional or free open emergency room space is having to be very, very, very tightly managed because of the pandemic stresses and loads. And so, but even prior to the pandemic, and knock on wood after this pandemic, if individuals don't have access to these care systems and use the emergency room excessively or not at all and wind up dying, then that ultimately comes back to you in a way that you may not see it in taxes, but you'll see it in increased insurance rates that ultimately get paid, because that care has to be reimbursed somehow. And if we're not there, then the healthcare providers start to look at other payers and see where can we spread these costs to. Thank
you, Mike. I'm going to move on to another question. I'll probably tee this up for both Mike and Lisa. The question is regarding the office administration and clinic consolidation. The question is, why do we need to spend $68 million on an administrative building? The money should go to more clinics and services in Travis County. And the funds should have gone to voters, not I think they mean Travis County Commissioners Court for approval. So it's really kind of three-part question, which I know has been discussed at several board meetings. And we also had a public input session for the community. But Mike, do you want to start with that
Yes,
one?
absolutely. Thank you. So first of all the budgets around administrative consolidation are projected budgets at this point, and those will need to be refined as we go on. Second, our board and the management team are committed to moving forward on the Eastern Travis County projects as a top priority. And that's going to be where our focus is over the next several months.
So it's not an either or.
That's right. It's not an either or. And now when it comes to, all right, let's look at the building that was purchased and start thinking about renovations. Please understand that when the board of managers of Central Health started to look at this issue, and this was back well before the pandemic started, it's a hefty amount of money that gets paid in lease costs, not only for Central Health, but some of our enterprise partners like Community Care and Syndetto Health Plans. And realizing that there were some cost savings, we set about looking at all the different options, building something from the ground up, buying something that currently existed, and renovating it, maybe build to suit, maybe consolidating even into a much larger lease, and then trying to see if we could capitalize some economies of scale. And started looking for opportunities, and it just they just weren't great, or even a prudent idea to move forward on them. And then along came this opportunity. And when you look at what we're going to spend per square foot, on this, even on a projected basis, it is much less than what we want to invest and are planning on investing per square foot for our health and wellness centers in Eastern Travis County. And so we believe that we can do this at a much lower rate per square foot rather than building from the ground up. But the last point that I'll make is the lease savings over time for the healthcare district, which ultimately are funds that can go back into the mission, is significant. And you get to the point of well over $100 million over a 30-year period, but even at a 20-year period, you have double-digit millions in savings that without this, you wouldn't have that. And we would continue to pay additional funds, which would then cut into what we have available for healthcare in our mission.
And Mike, those are savings that can then be reinvested in healthcare delivery.
Yes.
Correct?
Yes, correct.
Okay. I want to move on. We do have several more questions. And unless, Lisa, did you have something to add or to that question?
Sorry, everyone, I lost my internet, but I just came back. So
no worries. I think we covered it. We're gonna move forward. Thank you. There is a question, and the question is: has Central Health included the proposal for the African-American men's health clinic? I don't. Perhaps the question is: have we included funding for the proposal? I'm not exactly sure, and I can't answer that question. I don't know if Mike or Lisa.
Yes, I can answer that question.
Sorry.
So we've been in discussions and providing data to potential clinical partners that have been identified by the African-American Youth Harvest Foundation. I'm not sure exactly, as we sit here today, where those clinical partners are in their discussions with the foundation. But the way that this would work is that we, through reimbursements to the providers, for providing care for those that are in the medical access program, is one way that we can certainly help support an African-American men's clinic and hopefully men of color clinic, for Travis County and surrounding areas. But again, this would be through reimbursements as part of the medical access program. So that's the discussions that we've had to date. And if you see in our primary and specialty care budgets, there are funds available. Obviously, those funds are for the medical access program. That's what that's all about, and reimbursing for care. So there's been a number of us and staff levels that have been involved in some discussions, but again, I'm not sure where the clinical partnership discussions are at this point.
Thank you, Mike. I'm going to continue. I believe some of these questions are being answered on Facebook Live. Some of the answers to the question. This is Yvonne. I think you answered this question regarding: is this conversation more of a report on the budget that has already been determined? And I think, Yvonne, you covered earlier the budget survey that has been out in the field, so to speak, this summer, and how the responses to that survey helped provide guardrails, so to speak, for our budget process. And there is also a public hearing on our budget scheduled for September 2nd, which we will try to advertise and promote as widely as possible.
Yes,
So,
Ted, if
sorry,
if I can, no, thank you. If I can add, yes, so questions and comments during this community conversation will be added to the final engagement report that will be shared with our board prior to their vote on the budget. And people can still ask questions and submit comments online. And as you mentioned, Ted, there will be a public hearing, and we will be dropping a link with all of the with a list of opportunities for people to provide feedback and comments on the budget that will be then shared via a report, a final engagement report with our board prior to their vote on September 9th. And the link that I mentioned earlier is participate.centralhealth.net/2022 budget. But the comments from this community conversation will be part of that report. Thank you for the question.
Thank you, Yvonne. I'm going to move down to the next question. Central Health funds $35 million a year to the UT Medical School. Why don't you fund Capital Idea $300,000 for nurse training for many who are receiving services from Central Health? Capital Idea, which is a great organization, provides education funding to the working poor to empower them with better paying jobs, such as nursing jobs. Please provide this funding. That's a question/comment.
Yes, thank you very much for both the question and the comment on that. We will certainly make sure that the board, and some of whom may be on today and viewing through Facebook, is aware of this. I know this request has come up before in the past, and in the past, what has happened on Capital Idea is that there's been a contract between community care health centers and Capital Idea. And then assuming that the deliverables were met, then we reimburse community care. So we try to do as much as we can through our clinical partners to make sure that whatever it is that happens with endeavors such as the one with Capital Idea are centered around our patients and are benefiting the patients that we serve through our clinical partners. So, with that, I haven't seen any other requests coming forward from community care at this juncture, but certainly the board, like past times when this has been brought up, we'll make sure that the board is certainly aware of it. And of course, those members that are watching today are aware of it today as well.
Thank you, Mike. I'm going to move to a question and be mindful of where we are. Do encourage people to post their questions on Facebook. You can also submit them, as Yvonne said. And even if you have questions, because this conversation will live on after we close the live portion, we will continue to monitor the questions and answer the questions to the best of our ability. I'm going to move on to another question. It's a three-parter, but the first part of the question is Central Health in support of the creation of a public health commission, and how can Central Health help move it forward?
Yes, I've seen a document, and this was a couple of months ago, and it was, I forgot when it was first drafted, but I think it was a version of something that was drafted several years ago or a few years back. But I think what I can recollect from memory in this document is that this public health commission seemed to be a forum where you come together and address many of the issues that we're addressing right now, and we'll continue to address, as seen in this budget presentation, around health equity and addressing issues that stem from institutional racism and discriminations that have led to poor health for those living at the margins. And so I think that if there is such a commission, hopefully we'll have a seat at the table and going to be part of those discussions and bring forward the work that we're doing and will continue to do to help with this. And that'll help guide some of those efforts as it moves along. But I think, I know there's probably some steps that others need to go through at the city and the county level, but absolutely when that happens, we would hope that we would have a seat at that table and be part of that conversation.
Second part of the question is in regards to Central Health's plans on dealing with nutritious food as a core social determinant of health. We can probably tag team the answer. We understand, obviously, and believe that it is a critical part of somebody's health, access to healthy foods. Some of the things that we do is partner with the food bank on a summer lunch program. And I don't remember the number, but I bet one of my colleagues does, regarding how many healthy meals were distributed this week or this summer through the Southeast Health and Wellness Center. They were take-home meals by the week for families. When students are out of school for the summer, we realize that means that sometimes they don't have access to a healthy meal every day. Does anyone remember that number, Yvonne or any other of my colleagues? I forget the number. I think it was more than 4,000 meals. We also provide healthy cooking classes at Southeast Health and Wellness Center, and share those on all of our social media platforms to help people understand how to prepare affordable and healthy meals. Those are just a couple of examples. I don't know if anybody else wants to add anything.
Yeah, I'll add some things that I think, and I know we're talking about nutrition, but there's other ways that, we work with our clinical partners in serving the community in ways that don't involve clinical visits.
Right.
So even though it's not nutrition related, but I would note that some of the PPE events where we're handing out protective equipment, masks and hand sanitizer, also having vaccine events and back to school backpack events that are drive-through and held under safe distancing conditions to be able to get families ready for school, but also give them the opportunity to take the vaccine, which I hope everyone does, and to provide some additional PPE or mask and hand sanitizer. And I encourage everyone to continue to use masks and hand sanitizer. And so I think that, those are ways that we connect with the communities, especially in the pandemic environment. And for those of you that are listening on Facebook that came out, thank you very much. And those that volunteered outside of the Central Health Enterprise that you came in and helped out with those events, thank you very much, because they're great ways to connect with the community and provide these much needed services in this time.
Thank you, Mike. This is another question regarding the African American Health Clinic, which you addressed earlier. I'm not sure you can address this one on the fly, but we'd be happy to put together a more complete response. But does Central Health stand in allyship, partnership, and fiscal backing of the African American Health Clinic for the following things: clinic lease, project manager, and contracted services, planning, marketing, community engagement?
Yes. So I got a similar email from Terry Mitchell earlier today from the Black Leaders Collective. So thank you, Terry, if you're listening, or if that's you that's posted the comment, thank you.
It's Terry Mitchell, Mr. Mitchell.
Yeah. So thank you, Terry. I think that as far as being allied, I've had numerous conversations with Michael Lofton and our board of managers, member Shannon Jones, as well as with some clinical partners, but it's doing what we can to facilitate the necessary alliances to make something like this successful and impactful in people's lives. And so I think, I've also committed to writing a letter of support. I've asked for some additional information. I haven't received it yet. And so perhaps if you could help move that forward so that I could write a letter of support, I would greatly appreciate that. But in terms of the specific funding list, Terry, that you mentioned in your email earlier, again, the way that we proposed helping to support this is actually reimbursing through the medical access program for MAP patients. That would then help the providers, whoever that winds up being, that offsets some of those costs. And again, I know there's some conversations going on with FQHCs, the federally qualified health centers, right now. I'm not sure where they are. Last I heard, there was a preliminary deal reached, but again, I haven't seen any specifics. And so as those come about, then I think you're right. It's hard to say yes on the fly, but then once we see some numbers and a business approach, but more important, an outcome and equity, how this is going to be impactful and change physical, mental, behavioral health and dental, and provide the wraparound lab services and the wraparound support and counseling services that are so critical to maintaining the whole health of the whole person. then it'll be a lot easier to have conversations with those provider partners about what the reimbursement through the medical access program looks like.
Thank you, Mike. I have another question from Dr. Moody. Is there a budget for special initiatives, i.e. specialty care, chronic disease treatment and prevention, mental health? And this is something that Lisa touched on, or I'm sorry, maybe Mike, it was part of your presentation at the beginning, I don't remember, for groups that are most adversely impacted by long-term health disparities, speaking specifically about Eastern Travis County with a focus on African Americans and people of color. Building clinics is a great level of intervention, but engaging the community has to be a priority. Community trust and inclusion will massage the effectiveness of all programmatic interventions. We agree 100%. And just a couple of things Dr. Moody may be aware of. First of all, we engage with Dr. Moody and his team and other consultants to help us build community trust and increase inclusion. We've also expanded our community engagement team this year with the support of our board of managers, adding 2 community health workers to our team who are on the ground in the community, working in many different ways. But we agree, we can't just break ground and open a clinic and think the job is done. We have to let people know the services we provide, how to access those services, and also be a support system for all of the things that happen outside the clinic that create better health. But I'll let Mike or Yvonne or anybody else who wants to weigh in.
Yvonne, do you have any comments on that? I want to echo what Ted said, but I'll defer to you first.
No, I echo Ted's comments, and there are several initiatives that we've been discussing. One of which is also bringing food to communities in the Eastern Crescent, as a matter of fact, with Dr. Moody's team as well, and also in collaboration with other organizations such as El Buen Samaritano and the Central Texas Food Bank. We, like Ted said, we agree that there have to be some initiatives before we open clinics to be able to, so that we can continue to build community trust. So I fully agree, and we want to continue those collaborations.
And then I think back to the specific question about funds budgeted, absolutely. And I think you saw a quick slide that showed what the additional funding is, but that's on top of what we're currently investing in people's lives when it comes to specialty care, integrated mental behavioral health care, so that it's not just a standalone, it's actually part of the primary healthcare experience. And then again on other issues around substance use disorder. And so that's what you saw today on that quick slide was a summary of new investments, but that's of course on top of the several tens of millions of dollars that have been budgeted for the fiscal year that's coming up.
Thank you, Mike. We're at 12:27. I know we go until 12:30. There are a couple more questions. I can ask the questions. I don't think we can answer one of them. One of the questions is, how long is the wait time for new patients at community care? I don't have that number off the top of my head, but we can get that number, or at least try to answer that question by working with our partner community care to ask the question. I think there are a lot of caveats or dependencies on that one. Another question is, with all the money Central Health gets, why are we still living in a healthcare desert? Wow.
I think Ted, I'd like to take that one. You know, I don't think it was the last community conversation because we were in person, obviously, but this was back when we were meeting in person here at the Cesar Chavez building. You know, we would all like to wind back the clocks, decades, and even before the healthcare district existed, and make a lot of changes, right? Changes in public health investments, infrastructure. But, you know, we find ourselves where we find ourselves in this present time. And, you know, to me, it's, you just take up and you own the moment, right? Because you can't wind back the clock and do what would be ideal. And I think when you look at our investments in health and wellness centers in Eastern Travis County, and what we are doing with respect to filling gaps in care so that people can live the healthiest life possible. I mean, that's what motivates us. And there are a lot of deserts: food, healthcare, certain social services. But you keep putting a full measure of effort, doing what you can, when you can, where you can, and always mindful and make space and hold space for those voices that say, why is it still this way? Because that's what motivates you day in and day out. But I would say this organization has made some significant investments, even in the short time that I've been here, and much thanks to the board of managers for laying those organizational priorities, for making sure that we continue to do those investments and supporting us. And there's a whole lot more to come. And it just keeps getting better and better and better every year. So it's making progress, and that's what we're going to do. And we hope that you'll support that progress and support the acceleration of that progress as well. Thank you for allowing me to make those comments.
Thank you, Mike. I want to respect everybody's time. We are at 12:30 and we have come to the end. I think we covered all the questions, and if we missed one, I apologize. I'm trying to drive and fly and talk and chew gum at the same time. So we have captured all these questions. We will answer them in writing. If you have more questions, please feel free to share them and we will address those as well. And if anybody has any closing comments, you're welcome to share them now. I do want to thank everybody for taking time out of your very busy days during a very hectic and chaotic time. We do hope that you stay safe, that you get vaccinated, you make sure your friends and families are vaccinated so that we can start to relieve the stress on our healthcare system and all the frontline workers who are doing really hard work in our hospitals and clinics. So Yvonne, are you raising your hand?
Yes, two more things. One is I got a text that back to the summer lunch program, Ted, there were 753 packages that were distributed to families, and 1,056 meals that were distributed to families over the summer. And secondly, I do invite you to go to participate.centralhealth.net/2022 budget if you are if you would like to participate and actually be more involved with us to help us and join us in these efforts, the efforts that Mike Gislin outlined a couple minutes ago. I invite you to click the register button to keep in touch with us. We have a robust program of community health champions or community health advocates that really take it upon themselves to join us in this journey. And I invite you all to help to join us in this journey. Thank you so much.
Thank you, Yvonne. And I think I was speaking of the summer lunch program pre-pandemic. So that's why when I think I said more than 4,000. So my apologies.
Oh, okay.
I misspoke, and I appreciate the clarification. And I bet you Elizabeth was providing that to us. So thank you again. Thanks everybody for being here. And Yvonne will be our premier host at 1 o'clock for our Spanish language community conversation.
Thank you.
Thanks everybody.
Thank you all. Thank you for today's questions. We appreciate it. Stay safe and well.